everyone, and thank you for joining me today. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds, and today I will teach you how you can help your patients or clients save on their healthcare expenses. Before we get started, I wanted to go over a few tips so you can make the most out of today's presentation. You can feel free to ask questions by typing them into the questions section of your control panel. Just know I will reserve answering questions until the end. If I don't get the chance to answer your question, I will follow up with you via email. I'll provide my contact information and NeedyMeds contact information at the end. This webinar is being recorded and will be available for viewing on our YouTube channel. And you can find a copy of the PowerPoint slide deck I'm using in your handout section of your control panel. So let's get started with what is NeedyMeds. This slide covers our mission statement and how we achieve our mission, but simply put, NeedyMeds is a national nonprofit that connects people to programs that will help them afford their healthcare expenses. And we do this free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And one of the most popular and effective ways we help people to save on their medications is with our robust database of prescription assistance programs. Prescription assistance programs are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program, but when one is available, the eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional usually needs to be involved by providing a prescription, signing the application, and submitting the documentation. So, how can you find prescription assistance programs and other healthcare cost savings resources on the NeedyMeds website? So let me escape out of the PowerPoint and onto our live site so I can show you just that. What you're looking at now is the NeedyMeds homepage. Let me make it a bit larger so you can see it. And we're going to spend the bulk of today's presentation under this Patient Savings tab, where you can find all of our healthcare cost savings programs. A couple of things I do want to point out first, however. I mentioned the NeedyMeds YouTube channel. You can find a link to that using the YouTube icon, which is the third icon from the left, with the rest of the social media icons on the top right hand of your page. I also wanted to point out a new partnership we have with Medivizor. With Medivizor, you can get up-to-date, personalized, relevant, accurate information about your diagnosis delivered directly to your inbox, so you don't have to search the internet for that. If you're interested, just come to our homepage and click on the Medivizor link in that top box. Okay, so let's jump into how to find prescription assistance programs on the NeedyMeds website. Now, first of all, on the top left-hand side, you'll see a drug search bar. You could always type in the name of the drug to that field to do a quick search to see if there is a cost savings program available. But if you are looking specifically for a prescription assistance program, let your mouse hover over that Patient Savings tab, where all of those categories for healthcare cost savings programs pop up. And on the left-hand side, you'll see a box dedicated specifically to prescription assistance programs. And you can search for one a bunch of ways. You can search by probably the least common company or program name, but you can also search by brand name. So let's say you need help affording a brand name drug called Eliquis. I'll click on that hyperlink, and the first thing that happens are a bunch of icons pop up. What these icons do is they let you know what type of information is available about that drug. Is there a cost savings program, such as a prescription assistance program or a coupon? Is there additional information about that drug available, shown by support pages, which provide internet hyperlinks? How about a drug video, which is exactly what it sounds like, a quick video providing pertinent information about that particular medication? And we just added a new icon, I, to get additional drug information, which will directly connect you to the drugs.com page about that medication. Okay, returning to our search for a cost savings program for Eliquis, you will also see that convenient A to Z index. I'm going to go ahead and click on the letter E for Eliquis, and then I'll scroll down to see if that's available. When you find the name of the medication that is available, click on the hyperlink, and there are those icons again, indicating that there is information on drugs.com about Eliquis. There is a drug video available. There are further support pages. This icon indicates that there is a coupon, and the icon on the far left indicates that there is at least one prescription assistance program available. That's a hyperlink, so I'm going to go ahead and click on that. And let me make the screen a bit smaller. Don't worry about seeing the text. I just want you to see what the prescription assistance information page looks like. And they're all set up exactly like this. One thing I do want to mention, currently there is only one prescription assistance program available for Eliquis. If there was more than one, you would find that in this top blue bar, and it would say program 1 of 2, for example, or program 1 of 4. If there is more than one prescription assistance program, we will put the ones that list the most assistance at the top, and the ones that offer the less assistance at the bottom. So let's talk about what's on your screen right now. At the top, you will always find the name of the supporting organization as well as their contact information. And that's really important because you're going to want to be sure to direct all questions you have to the program as opposed to NeedyMeds. Next is the application section, where you will pretty much always find a hyperlink to the application. Scrolling down, and very importantly, you'll see the eligibility requirements section. And as I said, although eligibility will vary from program to program, it is almost always based on 3 factors: insurance coverage, income, and residency. One thing I just want to mention, a lot of people make the mistake that prescription assistance programs or other cost savings programs will only be available to those that don't have drug coverage or health insurance. And like this case, that happens often, but it's not always the case. So if you are helping a patient or a client that does have drug coverage, don't hesitate to check to see if there was a prescription assistance program available, because many of them will cover those that do have that insurance or drug coverage. You also always want to be sure to check out the NeedyMeds website or call our helpline, because if we can't find a prescription assistance program, there may be another cost savings program available. Eligibility requirements are also almost based on insurance. And because on income. And because income is almost always a certain multiple of the federal poverty guidelines, we put a convenient federal poverty income calculator right here. I just want to show you how easy it is. Let's say you have an individual that makes, and you can see I use this example often, $47,500 a year. You'll notice I typed in only the digits, don't type in periods, commas, or dollar signs, and that number is the same number somebody would put on their tax returns, for example. So this is an individual that makes $47,500 a year, and let's say he or she is supporting a family of 3. That's all the information you need. Simply click calculate, and the results yield that this individual's yearly income is 222% of the federal poverty guidelines. Now, when I return to the eligibility requirements, this individual clearly qualifies, which is great. But what happens if the calculation showed that this individual wasn't eligible? Maybe he or she found him or herself just above the eligibility requirements at, say, 305 or 310%. Well, when that happens, we actually recommend that you tell your patient or client to apply anyway, and then they can ask ask the program to make what's called an economic hardship exception. At that point, if they are still denied, they can always appeal. Now, as far as residency goes, don't make the assumption that if you are working with an undocumented population that they will automatically not be eligible. Always be sure to check out the residency requirements where we will provide the detailed information for each program. And if you are unsure what type of residency verification is required, you can always call the program directly. Also, be mindful of the application section. This has information about how and if the doctor needs to be involved and the time frame which they will make the decision. That's important because you don't want to put your patient or client in the position of missing their medications. The medication section will let you know details such as where the meds will be mailed and the details for reapplying. Always check out the additional information section too, because that is where we put pertinent information that does not fall neatly into the other categories. Now, before we move on from prescription assistance program, I want to point out something called our PAP tracker software, which you will find under the Advocates tab on the bottom left-hand side. PAP tracker is a software that eliminates the administrative burden of having to manually track and submit applications. If you're interested in learning more, send me a message in the questions section, and I will connect you to a colleague that will provide all of the details you'd need to know and set you up with the free demonstration. So let's move on to other ways to save on healthcare expenses. Returning to that patient savings tab, I want to point out our $4 generic discount drug program. This is a directory that lists all discount programs available for generic medications at major retailers. And although it's called the $4 generic discount drug program, most will range in price from a $4 to up to $15 for a 30, 60, or 90-day supply. As you can see, there are a number of ways to search. You can search for the name of the store or participating pharmacy. You can search for the name of a drug. I'm going to do a broad state search to see what programs are available in, let's say, the state of Michigan. So there are currently 15 stores or pharmacies that are participating in the $4 generic discount drug program. And hopefully you'll agree that all of the pertinent information is now on your screen, including the name of the store or pharmacy that's participating, as well as a hyperlink. The program name is in the center, and on the far right, the information you'll be most interested in is what savings the program provides. Now, as I said, most of them do range in up to $4 to $15 for a 30 or 60-day supply. Some of them can be more expensive, and some of them will actually provide you with an estimated savings with the percentage as opposed to a dollar amount. So let's move on to another helpful section and popular destination on the NeedyMeds website, which again is under that Patient Saving tab, and that's our free, low-cost, and sliding scales clinic database. Now, although there are 4 databases here, medical, dental, mental health, and substance addiction clinics, they're all set up the same way. So just for purposes of this demonstration, I'm going to go ahead and click on that medical clinics hyperlink. As you can see, this is a pretty big database as it has just under 17,000 free, low-cost, and sliding scale clinics across our country. And you can search really narrowly if you have a patient or client that is looking for example, a medical clinic in their area. You can search according to their street address at home or their work address. You can search by zip code, or you can do a really broad search to see what's available in your state. Let's do a quick zip code search and as you can see, I like to pick different ones when I showcase our website. So let's do 90006. We'll do some within 5 miles of that zip code. And the results generate that there are 67 clinics within 5 miles of that zip code. And since this database is so robust, chances are you will be able to find at least one clinic close to your patient or client's home. And then the results, hopefully you'll agree again, is that what you're looking at on your screen is all the pertinent information you need to know. We're going to talk about the print column in just a moment on the left-hand side, but let's talk about the other information that's on your screen. The clinic column, let me make this a bit bigger, has just that, the information about the clinic, including the name, address, and hyperlink to the website if one is available. The eligibility section lets you know who can be seen at the clinic, any fees that they can expect to incur, and the languages that the staff speaks. On the far right column, labeled Details, will let you know just that, further details such as services, additional services that this location provides, and the areas that they service. Although we pride ourselves on the information on our website being accurate and up to date, we always suggest calling or visiting the clinic's website to confirm pertinent information such as the languages spoken by the staff, the fee the patient can expect to occur, or even the hours of operation. Something that's really helpful is, let's say you wanted to print this entire list so you can share it with your patient or client. You can do that by simply clicking the Print All. Or you can narrow it down by choosing only the clinics you think your client or patient would be interested in and checking that box, and then choosing the print instead of the print all option. And this will generate and print a list including only those you chose. And again, that's a great tool for healthcare professionals that want to provide their clients with a list for them to choose from. So getting back to cost savings programs, returning to that patient savings tab, I want to point out our coupons and rebates section on the bottom left-hand side. And this is where you can find prescriptions and over-the-counter medications or supplies for which there is a free sample, a coupon, a rebate, a trial offer. Just like the other databases, there's a number of ways you can search. You can search by the brand name of the drug, the brand name of the product, but you can also search by the category, which in this case means medical category. Once you click on that hyperlink, you'll see an alphabetized list, and then you can choose the topic or the diagnosis that your client or patient would be interested. I'm going to click on the blood pressure hyperlink. Like the prescription assistance program on your screen, all of those icons will pop up, and that's really helpful because it'll let you know if there are other cost savings programs available, whether or not there is also a prescription assistance program, whether this medication is available through the $4 generic discount drug program, and whether or not there is additional information about that medication available. And again, the new link to find information is the additional drug information link with that eye icon, and that'll take you directly to the drugs.com page. And on landing pages on our site, where you can search by diagnosis, you will see a link to that Medivizor site that I pointed out earlier, which will provide your patients or clients with up-to-date and accurate information about their diagnosis. So let's look at what the results yielded. We actually just updated this website at the beginning of the year because we used to just have a paragraph of information, and that was hard to read. So we've since broken it down into bullet points, and we also put a manufacturer's website directly linking you to the offer so you can read more about it. We also put a convenient way to have the NeedyMeds drug discount card emailed, texted, or printed out. So people have found that pretty helpful. Please do be vocal about your experience with our website. We consider everybody that uses our website, especially healthcare professionals, our partners. So please be vocal about your experience if things are working for you. And in particular, if you're having difficulty finding something, please be vocal about that. Now, aside from the prescription assistance programs, The second greatest source of savings is through our diagnosis-based assistance programs database. Now, returning to that patient savings tab, you'll see a link for that right in the middle. Diagnosis-based assistance program provide financial assistance for costs associated with a particular diagnosis. Now, this database is different because for the most part, it does not include medicines. What it does include instead are other necessary medical expenses. Let's say your patient or client needs help affording medical supplies, medical equipment, testing supplies, or things like a wig, or house cleaning services, or assistive technology. You can search a number of ways by, for example, the program name. You can search by the program, geographically to see what's available in the state or nationwide. Nationwide means regardless of where the person lives in a country, they will be eligible to apply. And like the coupons database, you can also search by diagnosis. So I'm going to go ahead and click on that diagnosis hyperlink. And there's that A to Z index again. I'm going to make this a bit bigger so you can see the screen more clearly. And I'm going to go ahead and choose the letter D for diabetes. I like to use diabetes as an example because not only is it so commonly diagnosed in our country, but it's a great example of a diagnosis that requires a lot of expense in addition to medication. Often diabetics need things like testing strips, syringes, or sharps, or lancets. So because diabetes is a pretty broad category, we have it broken down into a bunch of subcategories. But just for purposes of the demonstration, I'm going to click on the general hyperlink for diabetes. And the results yield that there are currently 71 diagnosis-based assistance programs for diabetes. And you will find all of the pertinent information on your screen right now. The far left-hand column, the program name, will provide just that, the name of the program and a hyperlink. Next to that, you'll find a summary about the program. And the two far right columns are what you're going to be most interested in: the services that the program provides and the area of service. The services provided means just that. What will this program help your client or patient to afford? Oftentimes, it'll be something like medical supplies or assistive technology, but as you can see, it varies broadly. This program, for example, helps someone with respite care. These programs help somebody get access to a service animal, so it does vary from program to program. You'll also notice the areas of service. It says national. Areas of service means that where the person must reside to be eligible. The reason it says national, and that's repeated, is because we put all of the national programs at the top and then the state programs below that alphabetically. So returning back to that patient savings tab, we also have databases dedicated to other cost savings programs. And I'm not going to spend too much time on these. I just want to point them out because hopefully if I did my job well, you're starting to get the feeling of how to navigate your way through our website. One thing I do want to point out: if you ever have any difficulty or just feel more comfortable speaking with an actual person, don't hesitate to reach out to our helpline expert call center counselors at 1-800-503-6897. We are available Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. We're in Massachusetts, so don't forget we're on Eastern Time. And I do want to let you know that we do have Spanish-speaking counselors as well. And you can always simply give your patients or clients our phone numbers, and we're happy to help them directly. So getting back to that patient savings tab, as I said, there's a whole bunch of other categories that you can see. We have categories dedicated to medical transportation. We recognize that getting to and from a doctor's office or specialized facility can often be a burden. So we've put together a directory to help people with their medical transportation needs. We also have databases dedicated to camps, retreats, recreational programs, and educational scholarships for people living with a specific diagnosis. And for those of you that are in the senior community or work with seniors, a great resource is our government programs database. Of course, it includes all state-sponsored programs, but it does include pretty exhaustive information on Medicaid and Medicare. So now I'd like to switch back to our PowerPoint presentation so I can talk to you about another important way you can help your patients or clients save on their healthcare expenses, which is with the NeedyMeds drug discount card. So I just wanted to put up a snapshot of all of the cost savings resources we just reviewed. And now, as I said, as promised, we're moving on to the NeedyMeds drug discount card. Now, NeedyMeds drug discount card, I'm sure you've heard of other drug discount cards being available. A drug discount card is exactly what it sounds like. It usually looks like a plastic credit card that the person takes with them to the pharmacy to see if they can save on a prescription. Now, as I said, there are other drug discount cards available, but NeedyMeds differs in a bunch of ways. Not only is our card free, but it's anonymous. It requires no registration, no enrollment, no residency, and no activation. It can help you to save between 0 and up to 80% off the cash price of your prescription medications or over-the-counter medications and supplies as long as they're written as a prescription. And you can even use the NeedyMeds drug discount card to save on your pet meds if you pick them up at the People Pharmacy. A couple of other facts. Of course, not every drug or product will be discounted. And the drug discount card, when it is presented to the pharmacist, it offers a discount 85% of the time. And the chances are you or your clients or patients will be able to use the NeedyMeds drug discount card because it is accepted at more than 69,000 pharmacies nationwide. So the big question is, who can use the card? The simple answer is anyone. The only rule is it cannot be combined with insurance. So what that means is somebody doesn't have insurance, they can use the card anytime. But if they do have insurance, they may choose to use the card instead. And they may choose to do that if, for example, they find that their medication isn't covered, maybe they have a high copayment, maybe they have a high deductible, or maybe they're in a coverage gap. I also want to share with you that now you can use the NeedyMeds drug discount card to save 40% off the list price of medical equipment. And this includes products such as diabetic supplies like needles, testing strips, and meters, splints and braces for your ankle, knee, neck, and back, for example, catheters and incontinence supplies, bath safety supplies like commodes and grab bars, mobility devices such as canes, crutches, walkers, and wheelchairs, footwear like inserts, and so much more. Simply go to dmemyvirtualdoctor.com and then click Shop Now to browse the selection of medical equipment or search for your product in product categories. At checkout, you will simply enter the ID code on your NeedyMeds drug discount card and click Apply. It's as easy as that. So let's return quickly to the website so I can show you how to get your drug discount card tools, your drug discount cards and tools for maximizing savings. Now, right on the home page, you will see on the left-hand side a red arrow that says get your NeedyMeds drug discount card. If you click there, it'll take you to our drug discount card page where you can print out a downloadable PDF. You can fill in the form below, being sure to choose a design. The least convenient but still an option is by you or your client or patient sending up a self-addressed stamped envelope. And you can always reach out to our call center counselors who can drop a bunch in the mail to you. If you are interested in receiving a bulk supply of NeedyMeds drug discount card, we're happy to send those to you as well. And I'll provide contact information at the end of the presentation so you'll be able to do that with ease. Now, one other thing I want to point out is on that drug discount card page, if you scroll to the bottom, you'll find the pharmacy search, and that's exactly what it sounds like. It's a search to let you know what pharmacies accept the NeedyMeds drug discount card. So I'm going to do a quick pharmacy search. I typed in the zip code 80906, and the result yielded that there are 27 pharmacies within that zip code. Here's the great thing. Not only does it show you all the information, including the pharmacy's name, address, phone number, and even a map, but you can also print this list to share it with your patient or client. Now, let's say you've provided your client with a drug discount card, and now they know what pharmacies in the area accept it. The last step is knowing how much that medication is going to cost you using the NeedyMeds drug discount card. And to find that out, you simply click on the drug pricing calculator on the left-hand side. To find out how much that drug will cost, you need 4 pieces of information: the pharmacy zip code where the client is picking up their prescription, the prescription name, the dosage, and the day supply, meaning is the prescription for a 30, 60, or 90-day supply. Of course, if you don't have time to do this or your patient or client doesn't have access to the internet, reach out to our call center experts who can find this information for them. The idea is that the pharmacy tracker and the drug calculator will help your patients find out where to pick up their medication and what they will be paying before they head out the door. 2 other things I want to cover related to our drug discount card. If you are interested in us creating a customized drug discount card with your organization's name and logo, we can do that free of charge. And you can find out more about that by clicking on, under the Advocates tab, the link for drug discount card partnerships. So I'm going to transfer back to the PowerPoint presentation to cover a few more things. In the meantime, I encourage you to send any questions you may have into that question section of your GoToWebinar control panel. So this slide lists some easy ways that we hope to help you in helping your patients to afford your health care. The easiest, right at the top of the list, is to simply be aware of NeedyMeds and direct your patients or clients to our website or helpline. If you have other colleagues interested in learning about NeedyMeds and the resources we offer, I would be happy to conduct a personalized webinar or to even do one for your team. Just send me a message in that questions section. Under that Advocates tab I pointed out, where you can find information about a drug discount card partnership, under that tab you'll also find a bunch of information you may be interested in. Under that Advocates tab, you can sign up to receive our newsletter, program update emails, print materials, and more. You will also see a link to our Patient Assistance Resource Education, or PAIR, course and exam, which is a web-based, self-paced tutorial on how to find healthcare cost savings programs. So please do check that out. I also earlier on pointed out PAP Tracker, which helps you alleviate that administrative burden of manually submitting and tracking prescription assistance program applications. So please read more about that or contact us if you would like to learn more or have a demonstration scheduled. We can provide you with an unlimited supply of our most popular brochures and drug discount card. And again, we're happy to provide you with more information on getting a drug discount card with your organization's name and logo. As promised, I wanted to leave up the contact information for NeedyMeds. If you are interested in ordering a bulk supply of brochures or drug discount cards, you can reach out to my colleague, Alana. If you have any questions regarding this webinar, feel free to contact me at carla@needymeds.org. And of course, hang on to that NeedyMeds toll-free helpline, which is 1-800-503-6897. So I do see some questions coming in. Thank you for those. And again, if I don't get a chance to answer your question, I will follow up with you via email. The question that's coming in that we get a lot is, how does NeedyMeds support itself? So you can find an answer to that on the navigation tab under the About Us section. It's on the page with our mission statement. But simply, NeedyMeds relies on 6 sources of financial support: licensing fees for organizations' use of our database, the sale of that PAP tracker software that I mentioned, a small transaction fee every time our drug discount card is used, supported partners on our website, fees from pharmaceutical companies for call center and application processing services, and of course, as a nonprofit, corporate and individual donations and grants. Another question coming in is, in the beginning you mentioned you can use the drug discount card to save on pet meds. How? Actually, we put together a less than 10-minute video on how to use the NeedyMeds drug discount card to save on your pet meds. Go to the NeedyMeds YouTube channel, and again, you can find that on the NeedyMeds homepage on the top right-hand side with the rest of the social media icons. The third icon from the left is that red icon that says YouTube. If you go to the NeedyMeds YouTube channel and type the word pets into the search bar, you'll find the video. If you have trouble finding it, don't hesitate to email me and I'll be happy to send you the link. Oh, here's a great question again. What time is the NeedyMeds call center open? Great question. Thanks for giving me the opportunity to drive that point home. NeedyMeds is open from 9 a.m. to 5 p.m., but keep in mind we are located in Massachusetts, so that is East Coast time. And a reminder again that we do have Spanish-speaking callers. So we do try to keep the question segment brief, so if I didn't get the chance to answer yours, I will be in touch via email. With that, I want to thank you so much for taking the time to join today's presentation. And we do hope that you register for some of our other upcoming webinars. And you can find those on the calendar of events on the bottom right hand of the NeedyMeds homepage. For now, thanks so much for your time, and we do hope you stay in touch.